Hi everyone, it's Philip here again from Vet Education at the end of day one of the WSAVA conference in Suzhou in China in the year 2024. Now, I've attended some amazing lectures today, and the least of which was not an amazing lecture by specialist anesthesiologist Dr. Tamara Grubb, and she spoke on a topic that's very dear to my heart. It was anesthesia in the emergency and critical care patient. Now, she began the lecture by quoting Plato, and I'm going to read the quote. "The beginning is the most important part of the work." There you go. Who knew Plato was going to be quoted in an anesthesia lecture many thousands of years after he spoke those words? But suffice to say, Dr. Grubb really talked about reducing anesthetic risk, and it's so important in your emergency and critical patients. They present with oftentimes several comorbidities going on all at once, some of which can vitally affect circulation through very important areas of the body, notably the heart, lungs, and brain, and that can dramatically influence the safety of our anesthesia, the doses required, a whole bunch of other things as well. So she really went through the ASA classification system for anesthetic risk and how we need to approach our patient in terms of identifying patient problems and then trying to correct as many as we can to try to reduce that ASA anesthetic risk from a higher category with a higher associated mortality under anesthesia to a lower ASA risk stratification, which is associated with a lower mortality. Now, obviously, with reduced risk and reduced risk of mortality, it makes our anesthesia much safer and it makes things much more pleasant for us as veterinarians looking after our patients. So really timely reminder on just what we need to do for our patients, our emergency patients. Dr. Grubb also went through the pros and cons of a number of different medications that we might use as pre-medications for our patients, as induction agents, and as maintenance anesthesia agents. And in particular, I guess an underlying theme with all of these lectures on emergency anesthesia that I have heard over the years is that your inhalant anesthetic gases like isoflurane are negative inotropic and vasodilatory, so they don't do kind things to our cardiovascular system when patients are anesthetized. And Dr. Grubb really underscored this, and perhaps the value of continuous infusions of drugs like ketamine and lidocaine and opioids are extremely important in reducing the requirement for inhalant anesthetic drugs and subsequently increasing patient safety. And I guess at the end of the lecture, the all-important anesthetic recovery was emphasized because we know from the sepsis study conducted way back in 2001, has been backed up by a couple more studies as well, that anesthetic risk is highest for patients during anesthetic recovery. So it's very important for all patients, but particularly those emergency and critical patients who've had anesthesia, to monitor them very, very closely, to work on rectifying or normalizing abnormal parameters such as abnormal temperature and blood pressure and those kinds of things as well, to make sure that our patients recover under the watchful eye of us as veterinarians and our veterinary nurses and other support staff as well, along with all of our monitors, so that our patients get to live another day after their critical illness and the anesthesia that was there. So a huge shout out and a huge thank you to Dr. Tamara Grubb for a great lecture. She's an outstanding speaker. If you ever get a chance to hear her, I thoroughly recommend it. Thank you to WSAVA as well and the amazing crew here in Suzhou in China for putting on such a great event today. I'll be back tomorrow with some more, tips that I pick up from tomorrow's lectures. Got a whole bunch of lectures to go and listen to. So until then, take care. Hope you have a great night.